Thank you so much for joining me. I really appreciate you being here. This is Reagan Archibald, founder of Go Wellness Radio, East West Health, and the entrepreneur programs that we do. We also outreach into our community. We've worked with companies like American Express, Verizon, Parker Hannifin. We worked with so many individuals, and one of the questions that I get all the time is, how can I get off my medications? And the other question I get, well, what are the most commonly prescribed medications and how much are they costing? Because one thing that we're finding in our society is that medicine is moving in a new direction. So many people out there are looking for new avenues. In fact, it was it was 2002 when consumers in the United States started spending more money out of pocket on complementary and alternative medicine than they were on allopathic medicine. And now, 2015 here, and we are just seeing that trend continue to rise where people are looking for a different solution. But what I want to do today is talk to you about the top 10 prescription drugs on the market in popularity. I'm also going to talk to you about the cost, and not just the cost of the medication, but what they can actually do. Because one thing we've done is, in our 5 clinics now, we've got Park City just about ready to launch. So for those of you in Park City, get ready. We're coming up to your neck of the woods, or my neck of the woods. I live up here too. So we're going to be up here with Dr. John Lawrence. We just got back from a functional medicine conference in Texas, had an amazing time, and I am just thrilled to have him on our team. We've got some very bright individuals, and he's going to be one of the top on the list at East West. So, okay, so let's go through our goal for today. Let's go through top 10 prescription drugs and what their sales look like, and then we're going to talk about the cost and kind of the risks. And then ideally in our next podcast, I will go through and I'm going to talk to you about what the treatments are. And if you're listening to the recorded version, great. You can see it on the screen. If you're listening to the audio version, no problem. You can listen. And by the way, these facts, they come from WebMD or the Centers of Disease Control from the government. So let's get started. Okay, top 10 prescriptions in drugs. Can you guess what medication is the most commonly prescribed medication right now? It is Synthroid, with 21,561,481 prescriptions written. That is the first year. Actually, it was 2013 was the first year that Synthroid outperformed a statin. So, yes, it was Synthroid. Next one is Crestor. Crestor with 21,478,776. Ventolin is the next one. Ventolin HFA with over 18 million prescriptions. Nexium with just over 15 million prescriptions. Advair Diskus with over 13, close to 14 million prescriptions. Lantus Solistar is just under 11 million. It's 10,939,840. Vyvanse is at 10,413,000. Lyrica, 10 million, and just over 10 million. And that's surprising. Lyrica, for a long time, was a little higher than that. So, Spiriva, Handaheller is 9.6 million. And Januvia, diabetic medication, is 9.1 million. So those are the top 10 in prescription in cells. And that means in the United States, if you combine all the prescriptions sold, it is, it's 426,157,198 prescriptions sold in the U.S. in 2014. That's a lot. And that means out of a population, the U.S. population last year came in at 318.9 million people. That was the population. So what that means is every individual in our country is on a prescription medication. 1.34 is what that averages out. When I was doing the math, I was like, I can't believe that. So there is more prescriptions sold in our country than there are people. And yeah, by a third. So this is huge because we've run thousands of tests in our clinic. We've treated over 30,000 people, and never once have I found somebody that was, deficient in Prozac or deficient in Synthroid or deficient in Humira, or those sometimes drugs, they can be life-saving. And I want to put out a disclaimer that if you're thinking you're going to listen to this and just go get off your medication, that is very dangerous and reckless, and don't do that. Work with your doctor, or let us work with your doctor too, because most good doctors, they don't like prescribing medications, but that's the name of the game. Their hands are tied. In fact, if you look at the Centers of Disease Control, when they look at physician businesses, and they looked at that and they said, okay, so for how many people are coming in 2015, this is from May, is when they updated their website, but the number of drugs ordered or provided by physicians is 2.6 billion. Yes, billion. That's how many are ordered or provided. The percentage of visits when you go to your physician that involves drug therapy is 75.1%. So this is the system. It's not your doctor's fault. It's not the physician's fault, but that is a huge, staggering number that we can change. You and I can change this thing together, because the number one most common side effect from medication is tiredness and fatigue. Nobody likes to be tired. Nobody likes to be fatigued. And we all have this bigger purpose in life, this greater meaning. And so in order to fulfill that, we have to be on our game. And so I can't tell you how many times when my patients can get off their medication, how much better they feel. But it has to be done with your medical doctor. We don't just tell our patients, oh, just go ahead and get off that. That's crazy. And drugs can be life-saving, so we don't want you to jump off those. The three most frequently prescribed drugs are analgesics, so those are your pain medications, antihyperlipidemic agents, so that could be like drugs to reduce your cholesterol or your triglycerides, and then antidepressants. And here in Utah, we are the highest users of antidepressants. And it's not necessary. We don't have to do things that way in most cases. Some cases, absolutely. So, I want to give you a different perspective. That's why you listen in, and that's why you come see us. But let's keep moving on. Okay, so next one we're going to look at is what does this look like as far as revenue goes? Because I get asked all the time, okay, do I have to do medications if I start your program? And I'll say no, and we don't require anyone to get off their medication. But a lot of my patients, they'll come in on these medications, and if you ever want to have a fun activity, just do a quick Google search and look at side effects from medication, and you'll be pretty shocked. And then you can look at lawsuits, and that's also pretty scary. But anyway, I think the best way for us to cause a revolution in healthcare is for us to be educated. So here's just an overall perspective. And once again, you can find this information on WebMD. Medscape is another great location. And these are non-biased websites. They're not. They're very allopathic leaning. It's not like I'm on Dr. Mercola's website, which is great and phenomenal and very scientifically backed, but he's considered more of a outspoken individual. But yeah, this is CDC, the Centers of Disease Control. I think you'd be crazy to call them outspoken, but maybe out of touch. All right, sorry about that if you designed that website. Okay, so top 10 prescriptions, and this tops out the top 10. I actually looked at what the top 100 were, but I just listed 10 here. So Humira is ranking in at $8,290,000,000. Abilify, I'm sure you've seen a lot of commercials for that. This is an antipsychotic medication. Humira is more for rheumatoid arthritis. It is an immunosuppressant. Abilify, $7,995,000,000, just under $8 billion. So the next one, Sovaldi, is just under $7 billion. Crestor strikes in just under $6 billion. Enbrel, just under $6 billion. Enbrel and Crestor are like neck and neck. I'm sure they're incredibly competitive. Harvoni is 5.398, so $5,398,000,000. Nexium, just under that, it's $5,394,000,000. Can't even hardly say these numbers. I feel like I'm a mathematician tonight. The Advair Discus is 4.789, so $4,789,000,000. Lantus Solostar, $4,777,000,000. And Remicade, 4.6, so $4,614,000,000. That's a little bit of pocket change there. That's a lot. There's a reason why we spend what we do. We spend just under 20% of our GDP in our country on healthcare. And the problem is we're just masking it with either a pharmaceutical agent. As you can see, 75% of doctors' visits are based around a prescription, or we're just not getting to the underlying cause, and a lot of people go without the prescriptions when they need them, or they may need a different solution for their chronic conditions. So the total cost in pharmaceutical agents, prescription medications, is a staggering $194,540,743,010. And so that's an annual fee of over $600 per citizen. So that's a lot of money. I don't know about you, but when I did those numbers, I actually am pretty blown away. That's a lot. And it's not always safe. I mean, if you look at it, if you look at JAMA, that's the Journal of American Medical Association, this is a peer-reviewed journal, and what they found is that there's 225,000 deaths annually from medical errors, including 106,000 deaths due to non-error adverse events of medication. So if you look at this, okay, we're spending $194 billion, over almost $195 billion, but 106,000 deaths occur every year. It's been pretty average, making it the third leading cause of preventable death in our country. That's scary because this is expensive and it's dangerous. People's lives are at risk, and I think a lot of us, we downplay the realities of what could happen when we undergo the knife, or what could happen when we start taking a medication. How's that going to affect our quality of life? And so what my goal is let's help find a different solution, because where I see healthcare going, healthcare of the future, I mean, it's going to be so cool, because your smartphone will be able to outdiagnose 10 board-certified physicians. And I'm sure it'll do the same for whatever medicine that individual is practicing. Your smartphone will be able to get you 3 steps ahead of where you are now. It will get a quicker diagnosis. Then we can get the right treatment. But it's kind of, when we're looking at the medical model, it's going to be a team approach where there's education, there's lifestyle design, there's other testing. So the genetic sequence is important. But man, I think where the most exciting part of medicine is emerging right within your gut, in your stool. So that stool, that thing you flush down the toilet, is actually incredibly valuable when it comes to diagnostics. And it's gotten more valuable every year as we learn more and more about it. But healthcare of the future, it's going to be an integrated medical approach, because people are looking for natural solutions. All of us do not want to be on a medication. I mean, yes, they're life-saving in certain circumstances. And I've had so many patients that I'm so grateful they're on a medication, because it has gotten them through some very turbulent times. But healthcare in general is going to change where it becomes more preventative based and integrated. It's going to go from general to personal. So you're going to have a lot more personal touch when it comes to your labs, your ability to interact with your medical providers. Even now we have, in my clinics, we have so much ability because we have, Western medical doctors, we have Eastern doctors, we have nurse practitioners, we have personal trainer, health coaches. We look at the whole gamut. A wellness program is going to trump a single treatment solution because we're not going to keep chasing symptoms around. That's what's gotten us in the mess we're in, because if you chase a symptom, then you're looking for that Band-Aid to fix it. Robots are going to be optimized for medical procedures. So you need surgery. The robot you're going to know is not going through a breakup with his girlfriend or a divorce, or, robot's going to be 100% there and present. That's already happening now, but it's going to be even more prevalent. The collaboration is going to destroy the silos, and then healthcare teams will replace specialists, because right now, I have patients who go to 7 different doctors. And one patient goes to her endocrinologist for her diabetes. She goes to her urologist for her chronic UTI. She goes to her OBGYN. She goes to her oncologist for follow-up. Luckily she's free and clear of cancer. She goes to her orthopedist. She goes to her physical therapist, and she goes to her chiropractor. And it's like, wow, that's a lot. But this in the future, it's going to be more. There will be more teams practicing medicine. And then what you're going to find is the emergence of these new models of system in medicine that allow for you, the patient, or you, the provider, to be more interactive and have a better quality where we're not under the thumb of the system and the insurance company. So we can actually make some better recommendations. We'll have better scientific data, and we'll have a better track record of getting to that root cause. So I hope this has served you. I really admire and respect those of you who have been through so much. You've experienced challenges that I can't even fathom. Some of the things that you've gone through are incredibly inspiring to me because you've made it through. And so I just hope that you remember that your body can heal. You can make a difference to those around you. You can make a difference when it comes to your health by giving yourself the right environment. So stay tuned for our next episode. I'm going to give you some solutions, some natural ideas on how to take care of the medical conditions that pharmaceutical drugs are treating. And you can try it out yourself, work with your doctor on this, work with us if you'd like. My email is Regan, REGAN, @gowellness.com. And I just want to send you my love and my gratitude for you joining in, and keep sending in your questions, because that's how we can get you where you need to go.